Alright, so now for the next imaging modality in orthopedics, which we'll be looking at is the PET scan. Alright, so the full meaning of PET scan is what? Positron Emission Tomography. So we'll be looking at the application of this type of imaging in orthopedics. Okay, so application of what? Positron Emission Tomography in orthopedics. Okay, so we'll get to go about it like that. So positron emission tomography is actually what? An advanced nuclear medicine technique. Alright. So this technique actually allows functional imaging of disease processes. Okay. So to give you real-time details on the progression of a disease condition. Okay. So positron emitting isotopes with short half-lives are actually produced on site at specialist centers using a cyclotron. Now, various radiopharmaceuticals can be employed, okay? But currently, the most used one is what? The 18-fluoro-2-deoxy-D-glucose, okay? So the short form is what? 18-FDG, all right? So the 18-FDG is accumulated in different parts of the body where it can effectively measure the rate of consumption of glucose. That's basically the basics of this PET scan. So malignant tumors actually metabolize glucose at a faster rate than benign tumors. Okay, so PET scans are extremely useful in looking for occult sites or sites where you are having what? Malignant tumors around the body. Okay, and this is based on this principle of glucose consumption. Okay, so when you are combining PET scan is usually combined with your CT scan. So it's actually what? A hybrid examination. Okay, so performing both PET scan and CT scan on a patient in order to superimpose two images produced is the basis of combining this PET scan and CT. So the combination of these two techniques use the sensitivity of PET scan for functional tissue changes and the cross-sectional anatomy that you could be gotten from CT scan just to localize the position of this activity. So most of the times in orthopedics, we combine PET scan and CT scan. So PET scan is useful in what? Oncology. That's the study of cancer and all of that. Okay. And this to identify occult malignant tumors and metastasis and more accurately know the stage at which a disease condition is. Okay. So furthermore, activity levels at known site of disease can be used to what? Assess treatment and distinguish active residual tumor or reoccurrence from inactive post-surgical scarring and necrotic tumor. Okay, to help you to know the staging of the tumor, help you to know the site of the tumor, help you to know the type of the tumor. Okay, so that's the application of positron emission tomography in orthopedics.